Sexual health for transgender individuals encompasses a range of unique factors that differ from cisgender experiences. One significant consideration is the impact of hormone replacement therapy, HRT, on sexual function. For example, estrogen therapy may reduce libido or alter arousal patterns in transgender women, while testosterone therapy can increase libido and clitoral growth in transgender men. Understanding these changes is crucial for managing expectations and addressing concerns. Additionally, anatomical differences, whether pre- or post-surgery, require tailored approaches to sexual health, such as lubrication needs or sensitivity changes. Another critical aspect is the importance of regular health screenings. Transgender individuals may face higher risks for certain infections, like HIV, due to societal marginalization or barriers to care. Regular STI testing, regardless of surgical status, is essential. Mental health also plays a pivotal role, as stigma, dysphoria, or discrimination can affect sexual well-being. Open discussions with partners and healthcare providers about comfort levels, boundaries, and emotional needs are vital. Seeking care from providers knowledgeable in transgender health is highly recommended. Many transgender individuals avoid medical settings due to past negative experiences, but specialized clinics or LGBTQ inclusive practices can offer safer, more affirming care. Personalized advice ensures that sexual health strategies align with individual goals, whether related to HRT, surgery, or relationships. Education and advocacy are key to empowering transgender individuals to prioritize their sexual health confidently. Transgender individuals frequently encounter significant obstacles when trying to access sexual health services, which can negatively impact their well-being. Discrimination in healthcare settings remains a pervasive issue, with many facing judgment, misgendering, or outright denial of care due to ignorance or bias. This creates a climate of fear and mistrust, discouraging many from seeking essential services. Additionally, the lack of providers who are knowledgeable about transgender-specific health needs further complicates the situation. Many healthcare professionals lack training in gender-affirming care, leaving transgender patients to educate their providers or settle for inadequate treatment. Financial barriers also play a major role, as gender-affirming care, including sexual health services, can be costly. Insurance coverage varies widely, with some plans excluding transgender-related care altogether. Even when services are covered, high deductibles or co-pays can make them unaffordable. To navigate these challenges, finding LGBTQ-friendly clinics with staff trained in transgender health is crucial. These clinics often provide a safer, more welcoming environment and can connect patients with necessary resources. Advocacy for inclusive healthcare policies is essential to systemic change, pushing for broader insurance coverage and anti-discrimination protections. In the meantime, community support networks offer practical assistance, from sharing provider recommendations to helping with transportation or costs. Telehealth has also emerged as a valuable tool, allowing remote consultations with specialists who may not be locally available. These solutions can help bridge gaps in care and empower transgender individuals to prioritize their sexual health. Transgender individuals face unique challenges when it comes to sexual health, making tailored education on safe and inclusive practices essential. Hormone therapy, surgery, and anatomical differences mean that traditional sexual health advice may not always apply. Barrier methods such as condoms, dental dams, and gloves can reduce the risk of sexually transmitted infections, STIs, and should be used consistently, regardless of a person's gender identity or body configuration. Regular STI testing is crucial, as some trans individuals may avoid healthcare due to fear of discrimination, increasing their risk of undiagnosed infections. Open conversations with partners about boundaries, preferences, and consent help create safer and more fulfilling sexual experiences. LGBTQ+ health organizations often provide workshops and resources specifically designed for trans communities, covering topics like negotiating safer sex, understanding pleasure, and navigating relationships. Empowerment comes from having accurate information and feeling supported in one's choices. By prioritizing communication and education, transgender individuals can advocate for their sexual well-being while fostering inclusive and respectful partnerships. Access to affirming healthcare providers and peer-led initiatives further strengthens these efforts, ensuring that sexual health is both safe and affirming.